Dr. Teresa Everson. I'm the Deputy Health Officer for the Multnomah County Health Department. I'm about 3 weeks into this role. I've been doing health officer work for a while, so I'll do my best to answer questions. Happy Black History Month, happy Lunar New Year to everybody. Hey, Fa Choi. Before we get started, I just want to invite folks to do a quick share in the chat. If you just want to share your name, any gender pronouns you may use, what your organization or community you're from is, and then maybe just a 2-word check-in, and I will not be chatting, so I will just share. In full disclosure, I am tired because my toddler was vomiting all night last night, so bear with me if I seem a little bit hazy this morning. And we've already introduced our other staff. We're going to be on the phone. As far as our agenda, I'm going to kick us off by talking about when to test and talking a little bit about the different self-test kits that are out there. The video we're showing is specifically for iHealth, but we also have some information in our slide set about the Binax now. And then I'll be passing it over to Dr. Henninger, and Tony is here. And I'm not sure if Debbie Powers is also jumping in at all, but they're going to be talking about what to do with your test results, and then different COVID-19 treatments that are available to folks who are at high risk for severe disease, and how to access treatment. And then we're hopefully going to have plenty of time for questions. We'll try to leave some time for questions between speakers. And then definitely at the end, we'll save a lot of time for questions. And I also want to apologize ahead of time. This toddler that was vomiting all night, I got an appointment for at 11:20, so I'm going to have to deck out a little bit early. But Amy and the rest of our folks are going to be here for the duration to help answer those questions. Before I start with our slides, I just want to start by acknowledging that we are all entering into our 3rd year of COVID-19 response. So we're all kind of exhausted. We've all been going through trauma and loss, but this has especially hit our BIPOC communities, our folks with disabilities, people with low incomes, our LGBTQIA communities, and others who've been systematically disadvantaged and have been hardest hit by this pandemic. We see you. We're really grateful for the countless ways that you show up to serve your communities, and we can't do this work without you. So thank you. And with that, I'll dive right into our slides. If we could go to that next slide. Thank you, Al, for driving. So I'm going to start out with who should be tested. And the first thing to know about these tests is they're only intended for folks who are 2 and over. For the iHealth and the Binax now, they both include instructions that you shouldn't be using them for anybody under 2. So if you have somebody that you're working with or somebody in your household under 2, really they should be going to a testing site, and most testing sites will start testing at age 2 months. So 2 and up, and then we recommend that for children that a parent, guardian, or caregiver perform the test for them. Also, a parent, guardian, or caregiver should assist with testing for anybody who can't safely perform the test on their own. And there's really 2 big buckets of folks who should be getting COVID tests. I think most of us are pretty familiar with these recommendations by now. Their first category is people who have COVID-19 symptoms. And I included there, ideally it's the day after the onset of symptoms. If you've been paying attention to media about effectiveness of our tests, we've really figured out that especially with Omicron, sometimes if you test with that very first tickle in your throat, or when your nose just starts getting drippy, that it might not catch your infection yet. It might not give you a positive result. So we're encouraging people to maybe wait until the day after, or 36 hours. After you start getting those symptoms. So that's the first bucket, is people who've got symptoms. And then the second category is folks who have known exposure to COVID-19, and I'll specify people who are close contacts to people who have COVID-19. So that's that CDC definition of at least 15 minutes of close contact, less than 6 feet, over a 24-hour period. And then for those folks, ideally that testing happens between 5 and 7 days after the exposure, again, to allow time for people to maybe build up enough virus for that test to pick up. So those are 2 categories, people who've got symptoms and people who are close contacts. Next slide, please. And kind of beyond those 2 big buckets, anybody who's fitting those 2 categories should do a test if they have access to a test. But beyond that, there's a couple of different groups that we really focus on and really want to make sure that we're putting our energy towards making sure that they get tested. That first category is people who have the highest risk of having a severe illness, so highest risk of being in the hospital or dying from COVID-19. And those are our folks who are older, who have underlying medical conditions, including our folks who've got severe immune compromise, moderate or severe immune compromise. And specifically, that recommendation is so that they have time to seek antiviral treatment, which we'll be talking about later in the presentation. The next category of folks that we really should prioritize testing for is anybody who's sick who lives in multi-generational housing or home, people who live in group settings, or people who work in close proximity to others. And ideally, again, this testing is on day two or three of symptoms, not on that very first day of just a little bit of symptoms. So waiting at least a day if you can to help determine when they may safely return to work, school, and family life. And really the point of that is to figure out when they've got COVID, to help figure out when it's safe for them to stop isolating and kind of get back to things. And then finally, that third category gets back to the close contact group. So people who live in multi-generational homes or housing, or live in group settings, or work in close proximity to others who have known exposure to COVID-19, to determine if they have asymptomatic or pre-symptomatic infection, which again means you're sick and you don't have symptoms, or you're sick and you just don't feel it yet. So we've got those two top ones, which are folks who are sick, and the bottom one is folks who are close contacts. And I included that bottom paragraph because I've certainly experienced in the past couple of months, and maybe many of you have as well, that sometimes you don't have enough tests to test everybody that you need. Sometimes you don't have any tests at all. Certainly that happened for us in my household. So we just wanted to include how to consider who you should test if you have limited numbers of tests for your household. And really, we're trying to figure out who is the highest yield person in the house to do a test. So who's most likely to have a really accurate test result. And it will be the person who got sick first, as long as it hasn't been too long, because after a period of time, you stop shedding enough virus for the test to pick up. So we put in there the person who got sick first, as long as it's not more than 7 days ago. So that just increases your chances of getting a positive result. And then if that person's positive, you can assume that other folks who got similar symptoms at home probably also have COVID-19. So next slide, please. All right, just as important is what these test kits are not intended to be used for. So it's just those two things, just people who are sick and close contacts. These test kits that we're able to provide are not to be used for screening purposes. So if you're going to be going on a trip, or if you're planning on attending an event or a social gathering, or you want to go to a basketball game or whatever it is, you should not be using these test kits for screening purposes. They're also not to be used for employment or return to work purposes, which kind of falls into the screening category, but it's more of a specific thing. And then those last two that say that you're not supposed to use them in healthcare settings or in shelter settings, not because we don't want to test those folks, it's only because there is a different allotment of tests for those groups. So they will be getting their own tests, if that makes sense. All right, next slide. So we have a video. We're just going to watch one. I know we only list 2 languages for the iHealth and 3 languages for the By Next Now. We're kind of asking folks to share if they have good resources for other languages. These are just the more official ones that we have right now. We do have in development, it's supposed to be finalized today, written handouts, instructional information for both iHealth and By Next in 12 different languages. So there should be soon today. I'm looking at my watch that doesn't exist. There should be ready today. And for this video, I will just say this person is very, very chipper. If you're not this excited doing your test, don't worry about it. I don't think anybody's that excited doing their test. But I like this video because it's thorough, it's kind of fun, and it's kind of brief. So let's watch, and then we'll come back together after.
Video for the iHealth COVID-19 Antigen Rapid Test. Let's learn how you can complete the test all by yourself and read your results in just a few minutes. For starters, thoroughly wash your hands with soap and water. We also need a clean, flat testing area. Take a moment to disinfect some counter or tabletop space. Once it's dry, lay out the following items from your kit, but don't remove them from their individual packaging just yet. In the box is a swab, a test card, a test tube. Your test tube will likely have the testing solution already inside, but in some cases, you may have received the solution in a separate packet. If so, no problem. Remove the larger lid and then carefully tear off the top portion of your solution packet. Pour the entire contents of the packet into the tube. Careful not to spill. Now, put the lid back on the tube and you're ready to go. Tear the foil packaging off your test card and lay the card upright so that it's ready to receive your test solution once you've taken a sample. Open the handle end of the swab package and pull out the swab. Be sure not to touch the swab end with your fingers or bring the swab into contact with any potentially germy surfaces. Which brings us to the fun part we know you've been looking forward to. Yes, this thing's going inside of your nose. But, lucky for you, The iHealth Rapid Test Swab is specially designed for simple, comfortable testing. It barely has to be inserted into the nostril, about 1/2 to 3/4 of an inch. Easy. In a circular motion, swab as if you were cleaning the inside of your nose. Note that this is not a matter of simply twisting the swab in place. When you've finished, swab your other nostril the same way. You think you got it bad? I'm the one who has to keep saying nostril. Insert the swab all the way into the solution. Twist it back and forth in the solution at least 15 times. And as you're removing the swab from the tube, squeeze the sides of the tube to wring every last drop of delightful solution and sample out of that swab. Then replace the large lid back onto the tube. You can now say goodbye to that swab. You grew so close in such a short amount of time. Now, let's test the sample. Remove the small dropper lid at the tip of your test tube and carefully squeeze 3 drops of solution into the receiving port on the test card. Set a timer for 15 minutes. You'll see your sample being slowly absorbed into the test strip, and over the next 15 minutes, your results will appear on the test strip as lines under the C and potentially the T. After 15 minutes, you can officially read the results of your test. But be aware, you only have another 15 minutes to read them before the results are officially considered invalid. It's a good idea to set another timer. Let's read your results. The C line is the control line. A line should always appear under the C. This tells you that the sample has been absorbed into the strip and that the test card is valid. If no line appears under the C, then the test card is invalid. If possible, you will need to test 3 drops of your sample on another card. The T line is the test line. A line will only appear under the T if you have tested positive for the virus. If there is no line under the T, then the test did not detect any virus in your sample. Nice! Be aware that depending on certain factors, such as how long the virus has been in your system, the line under the T may be very faint. Regardless of how light or dark, any line at all under the T means that you have tested positive for the virus. If you're unsure, you may wish to use a magnifying glass or hold the test card under a bright light for closer inspection. And that's it. If you tested positive, don't panic. Seek advice from a medical professional on your next steps. You can also go to cdc.gov for more information about how best to keep yourself and others safe. If your test is negative, be safe.
I'm guessing for most of you that is not the first time that you've seen how to do a test or that you've done a test. But I know for me, I'm actually pretty new to the iHealth. I've only had access to the Binax now until now. So for some of us, maybe that's information about a test that you haven't used before. And I'm not going to go through kind of piece by piece all of the subsequent slides, although we can go to the next one. But I did want to take some time to point out similarities and differences between the two. And then I also want to point out that the slides that we have here were taken directly from the informational handouts that are going to be going with the test. So this will look exactly like what is going out with the test for folks to reference. As far as similarities, I'll say they can seem really different, the Binax Now and the iHealth, when you put them side by side, but honestly, about 90% of what you're doing is the same. And the only real difference is where you're mixing the sample from your nose with the solution. For the iHealth, it happens in a tube. And the ones that are getting sent out, I believe, are going to be the ones where you have to add the solution into the tube yourself. So that's the biggest difference, is the iHealth you're mixing in the tube. And then for the Binax Now, I'll just show you, I've got an expired one. I don't know if you guys can see it, I'm gonna hold it up to my camera. You shouldn't ever mix it flat, but you're actually mixing in the card. There's a space down at the bottom for you to drop your solution in. And the really lovely thing about both of these tests, they spent a long time perfecting how to label everything to make it as clear as possible, down to making sure that the swab packets are labeled which end to open, to try to make sure that you're not touching the end of the swab and maybe affecting your results. So just highlighting a couple of those pieces. This first slide reminds folks to make sure that you're washing your hands before and after, which is really important. It also highlights you can only use each test one time. And we've had this question quite a bit, especially when testing is hard to come by. You can really only use each test kit once, and then it has to be thrown away. And then let's go to the next slide. Yeah, it just talks about laying everything out, making sure you read your instructions ahead of time so you can kind of get the sequence of the things that you're doing. Let's go to the next one again. Thank you. There's a reminder here about making sure that you're not touching the end of the swab. And then this protocol for what you're doing with the swab in your nose is the same for both. The main point is it needs to be rubbing around on the skin on the inside of your nose on both nostrils for about 15 seconds total. It doesn't work if you just kind of put it in the middle and just swirl it around kind of lightly. It really needs to be rubbed around. It doesn't need to go in very deep. 1/2 inch to 3/4 inch is not very much. It's going to be that much at the most. So it's almost just the length of the soft part on the end of the swab. So it doesn't have to go in very far, but it does need to be about 15 seconds. And let's move on to the next slide. And this is specifically for the iHealth, talking about the tube. They talk about tapping the tube, and that's really just to make sure that the liquid is all at the bottom, because you may have laid it down with the cap on while you're collecting your sample. Let's go to the next one. There are differences, if you want to go back again, sorry about that. There are differences in how long you're supposed to be mixing your sample with the solution. For the iHealth one, when you put the swab into the tube, you need to put it all the way down until the cotton swab is touching the bottom. Then they ask you to stir it 15 times. So it's really to make sure that what you got out of your nose is mixing really well into the solution in there before you take the swab out. And again, that advice about pinching the tube is really important to try to get out every last little drop of your sample from your nose into that solution. And then the difference with the Binax Now is that you are putting the whole swab from your nose inside the card where you've already dropped your solution. And then once you put it into this spot, I can show you here, there's 2 holes here. You put it in the bottom spot and you're kind of putting it up like this until you can see the cotton come out the top swab or top spot. And then you swirl it 3 times. So you just have to read the instructions to know, okay, am I stirring it for however many seconds, or am I just spinning it around? And the nice thing again is that everything is labeled really clearly. So this card has a picture that says 3 times around on there. So just make sure you're paying attention to the directions. They steer you pretty clear. Let's go to the next slide. All right, they talk about adding that sample. Let's go to the next slide. And then waiting. For each of these, it's the same wait period, which is nice. And I don't know if there was direct collaboration between the companies to try to make things as similar as possible, but it's nice that it's the same. So you need to wait at least 15 minutes. We do recommend setting a timer, and it's really important that you just set it down and leave it. It should be laying flat for that solution to kind of work its way through the test. So lay it flat at least 15 minutes, and then no longer than 30 minutes. If you come back after 30 minutes, then you may not get an accurate result as well. I don't want you to memorize how to try to figure out if things are valid or invalid. All of that information is going to be on the instructions that come with the test kits. But the really important thing to remember about that is there should be a control line. Both of these tests have a C for control, and there should always be a line right there. There's a little bit of nuance with Binax Now that they want you to be seeing a specific color of control line. It should be pink or purple and not blue. But really, if there's no control line, then your test isn't working. You probably need to test again. And then you're looking for whether or not there's a second line. If there's 2 lines, and that's considered a positive. For the iHealth, it's under the word or the letter T for test, and then on the Binax Now, it's under the word sample or next to the word sample. All right, let's go to the next slide. All right, let me make sure I didn't have any other thing I wanted to share. I think that's enough. If we have a little bit more time later, I'm happy to try to show the card for the Binax Now. It's pretty similar. It also has a little solution thing where you have to twist off the top, and that's what you drop onto your card. And then these swab packets are really clearly labeled, like peel here or open here for the end that you're supposed to open. But I want to make sure that we save time for Dr. Henninger and everybody else and save time for questions. So I'm going to stop there, which means we're going to go past these next slides about the Binax. And then Amy, are you okay kind of starting to lead us through the chat in case there's questions?
Yes, no questions that I'm seeing right now in the chat. I know Dr. Everson's only with us till 10:45. So if you have any public health quarantine isolation questions, go ahead and type those in right now. Or raise your hand and you can come off mute.
Yeah, and if there's anything that comes up after I go, maybe we can figure out a way to get me questions and I can try to get some responses back.
Definitely. I can compile the questions and get whatever you don't answer to you afterwards.
Great. Maybe while people are thinking, we can kind of get moving forward with the rest of it. Is that okay?
Yeah.
All right.
So what to do if you test positive? So stay home except to get medical care. Isolate yourself as possible from others in the household for at least 5 days. If you have no symptoms, so you have a positive test but no symptoms, and feel well, or once your symptoms are getting better after 5 days, it's fine to leave the house. You're going to wear a well-fitting mask around others for 5 days, 5 additional days. So that is a KN95, a medical procedure mask covered with a face covering, or a face covering if that's all that you have. If you have a fever, continue to stay home until you don't have a fever. Next slide. You're going to watch for symptoms if you test positive and you don't have symptoms, and seek medical care if you feel worried or if your symptoms get worse. Tell your close contacts and household members that you've tested positive. Call your healthcare provider as soon as possible if you're having moderate or severe symptoms, or if you have other medical problems, because there may be treatments available, but some of those treatments are only available within the first 5 days of symptoms. If you don't have a healthcare provider, you can call 211 for help finding one. OHA has a great new hotline for reporting positive test results. It's not mandatory. You can call them if it's helpful. They also have options for support during that isolation period, and the number is listed, and I am sure that Ellie will be sending out these slides. Next slide. And then if the test is negative and you feel well, continue to practice general COVID-19 safety precautions, washing your hands, wearing your mask, distancing from others, particularly if you were exposed to COVID-19 and you could be in that pre-symptomatic period. If you think you may have COVID-19 because you were exposed, or you have symptoms and you still have that negative test result, we do recommend quarantine and seeking another COVID-19 test through a healthcare provider or a testing site. These tests do come with 2 tests in each box, so you could also repeat that test in 24 to 48 hours. If you are a close contact to someone who had COVID-19 and are unvaccinated, you should stay in quarantine for at least 5 days from your last exposure to that individual with COVID-19. After that, wear a mask around others for an additional 5 days. If you have been a close contact and have symptoms, you could still have COVID-19 and continue to quarantine until your symptoms improve. If possible, get tested through your doctor's office or the health department. If you're sick, stay home until your symptoms have improved and you have not had a fever for at least 24 hours before returning to work or school. And this is all assuming that test was negative. Teresa?
Yeah, thanks. You're reminding me. There was something I was going to add in before we got into the video, just talking a little bit about the chances of getting a positive or a negative test, because there's been a lot in the media about, can we trust these results? Is this test very good? And the rapid antigen tests are still very good at detecting Omicron, this particular variant of COVID-19. There's a little bit of nuance in how quickly and how well, not how well, but how much our bodies shed virus for the test to pick up. The test itself is very good at detecting virus that's there. With that, I will also say it's a very sensitive test, which means if someone has COVID-19 and they're shedding enough of the virus, they're going to show it. And the specific number that the website cites, which is kind of with all the stars aligned and kind of everything going well, that out of 100 people who had COVID-19, the test will pick up 94, which is actually a pretty good performance for the test. But for folks who have symptoms, it doesn't perform quite as well for folks who don't have any symptoms at all, or people who are pre-symptomatic, like maybe in the day or two before they're going to get their symptoms. But for folks who have symptoms, it's a very good test. And in general, if you see a positive result, you should believe the positive result. There are very few false positive results. It's just sometimes we see false negative results, which is why we take all these precautions around, you know, if you still have symptoms, make sure you're being careful. So thank you. I just wanted to throw that in there because I missed it earlier.
Yeah, thanks. Next slide. So in terms of the community health center at Multnomah County, if someone is sick with COVID-19 and they don't have a primary care provider, they can definitely get services with us, whether or not they have insurance. If you don't have insurance, clinic staff will screen for Oregon Health Plan eligibility. And regardless of insurance, you can receive care. You may have to pay a sliding scale fee depending on your income level. Next slide. Definitely, if you're calling to establish care or get an appointment with us at the Multnomah County Community Health Center, let the call center staff know that you had a positive COVID-19 test and any symptoms that you're having. You may be eligible for COVID treatment, which will be free of charge. If you're not eligible for treatment, you can still receive advice or care related to COVID. And don't wait to call because we do have treatments available. So it's best to call as soon as you have a positive test result if you're high risk or you have moderate to severe symptoms. So we currently have 2 antiviral treatments available at our health center. They're called molnupiravir and Paxlovid, which is nirmatrelvir and ritonavir. Community health centers have been given access to these medicines prior to other organizations having the medicines, which is a huge step in starting to address some of the health inequities that are faced by the populations that community health centers serve. These 2 treatments are used within the first 5 days of symptoms for those folks who are at high risk of COVID-19 hospitalization and death. And we're following the CDC criteria for high risk, which includes many of us. Since vaccination really lowers the risk, we've definitely been focusing on those folks who are not fully vaccinated and are at risk. And one additional thing is that these treatments are currently under the Food and Drug Administration emergency use authorization. So just like the vaccines initially were and other treatments are, these are still under that EUA status. Next slide. Some treatments do require a second COVID test beyond the home test. These 2 do not. If you need a COVID test at the clinic, we can help you get that set up. And I'm going to turn it over to Tony to talk a little bit more about our access at our health centers.
Good morning, everybody. My name is Tony Gaines. I use he, him pronouns. Thank you for having us here. As Amy mentioned, our call center, also known as our Patient Access Center, helps support our clinics with getting patients connected with COVID testing. And yes, we still do provide access to the vaccine at our primary care clinics. So obviously, as Amy mentioned, that is one of the best ways to reduce the spread of COVID-19. And we offer testing and the vaccine at our primary care clinics. Our call center is open Monday through Friday for dental care and primary care services, with the exception of our primary care services being open from 7:30 to 5:30. And our dental care services being open from 8:30 to 4:45. So if you have any questions about some of the exceptions to that, because some of our clinics do COVID testing, some don't currently, and some provide the vaccine on certain days and not others. Please feel free to reach out to me, whether it's email, chat, whatever works best for you, and I can provide you more information on the services that we provide and when. Thanks, everybody.
Thanks, Tony. And we do have capacity if someone tests positive for COVID. It's just really important that you let the call center know to get you in same day, next day to be evaluated for those symptoms and possibly for treatment. Next slide. Teresa, can you take this, or Ellie, can you take this?
Yeah, I'm realizing we didn't talk about who's going to cover these last couple of slides since Beth isn't here. Are you okay doing this one now?
Yeah, I can do this one. So a couple weeks ago at our previous meeting, we talked about some ways for organizations and individuals to access test kits. And we have received some test kits through Multnomah County that are intended for organizations that reach a significant number of BIPOC and immigrant communities. And so that order form link is listed here. In this first shipment, my understanding is that organizations are limited to about 90 to 100 test kits. But the hope is that we will be getting more soon. I also learned that you'll get your test kits quicker if you elect to pick them up, but they can be mailed to you as well. And then there's also test kits available through Oregon Health Authority. You do not have to be a registered 501c3. They just ask that you're an organization that, again, serves priority populations that face significant health inequities in our communities. So that form is listed here. And then finally, there's the federal government link, which is those 4 test kits per household. If you haven't done so already, mine got here pretty quickly. So those are nice to just have on hand as a testing option. I think that rounds out our slides. Oh, there's one last slide here on support for isolation and quarantine. OHA a couple of weeks ago launched their new hotline, kind of moving away from the local public health contact tracing and case investigation, where individuals can report their test results. And then you can also direct any questions you have about, isolation and quarantine, ways to keep yourself and your family safe to that hotline. So just know that that's a resource available to you.